HIPAA Check, I mean, we've talked, you say this really separates you from what's available out there.
I don't know
to dentists.
any IT company, and we know hundreds of companies. I don't know a single one that's offering HIPAA services to their clients.
Give me an overview of what you're offering, what this is.
So the goal with HIPAA Check is to try to get offices as HIPAA compliant as they can possibly be. It's virtually impossible for a dental practice to meet all the hundreds of pages of regulations, but there are some core things that they really should be doing. First is encryption. That the government says that you really should be encrypting the data in the office, on your backups. There's something called a breach notification rule that could be devastating for a practice. If you are aware of a breach of your data, you have to notify all your patients in writing, you have to notify the local media, and have your practice listed on Health and Human Services website. It will be devastating from a practice. You have one get out of jail free card, and that is encryption. If you've encrypted your data, encrypted your backup, you're exempt from that breach notification rule. So that's the first part.
And by the way, is there anybody getting in trouble over this?
Across
absolutely. The country?
Just go to the Health and Human Services website. There's a bunch of dentists.
So it's not something the dentists are going to brag about this at their study club meeting or whatever?
No, the typical fines are $25,000 to $50,000 for first-time offense,
right?
$1.5 million for what they call willful neglect, which basically means we already warned you and you didn't listen, so now we're really going to make sure you remember us. And it can be very devastating. I think where it would hurt practices the most is having to send that letter out to patients. You're going to lose patients for sure. How many, it remains to be seen.
So your HIPAA Check takes care of that in what way?
We encrypt the data. We can encrypt the server, we can encrypt laptops, the backup, all the data that's in the office.
And that's not just part of all the data backup that is offered to dentists?
Most of them do not encrypt their data at all.
Interesting.
Because it makes it easier to restore. If you don't have to worry about a security key, it's easier to back it up online or locally and not have to deal with encryption. But it is critical. You are definitely going to be in violation of HIPAA rules and regulations if that data is ever breached.
Now, because of this, have you become like a HIPAA expert? I mean, it's like a couple hundred pages for dentists plus.
Yeah, I'm not sure if there's other people that do just
so you surround
HIPAA.
yourself with
There's people smarter than me that have helped us to develop our systems. We based our HIPAA check on the HIPAA regulations and the high-tech rules, which started in 2009. So we've actually spent the last 4 years customizing and really trying to tweak the system to make sure it's ideal for our dental clients.
Okay, now you in your material, you say you have a cloud-based self-assessment. What does that mean?
Most dentists aren't aware of the fact that in order to be in compliance with HIPAA, you have to have all the policies and procedures in place for your office and documented. There are written manuals out there. The problem is that HIPAA changes so rapidly that those manuals are outdated the minute the ink hits the paper.
And who's in charge of this in the office usually?
Well, usually it's given to the office manager or the dentist, but in our experience, unfortunately, hardly anyone's doing it. That they might buy a HIPAA manual and fill out a couple of forms and feel that they are in compliance, and that's not the case. If you get audited, one of the first things that the auditor is going to look for is to make sure that you have all your policies and procedures in place. So we're not a fan of the printed manuals because they're always out of date. We believe in a web-based system. So
you do have like compliance documents that they could, download, print if they have to?
They can download the documents, they can customize it for their practice, fill out the information, upload it to the web, and the beauty of that system is that it would also let us know, by going through a series of questions, it will let us know where the practice is falling short. Where are they falling short in their compliance? What do they need to do in order to get themselves more compliant? So it kills two birds with one stone. We have all the policies in place, and we're able to let them know, here's where you need to tighten up if you really want to be more in compliance.
And the digital dentist, okay, they call you the digital dentist, is that right?
Yeah, that's
I mean, do
correct.
people even say it like when you go to shows or when you go to whatever?
That's my booth. It says the digital dentist.
Do they ever call you personally that sometimes? There he is, the digital dentist.
Yep, they do. I have my groupies.
So because of, I remember 10 years ago, very few medical doctors that I knew were paperless. And now you're seeing a lot of that, right? Digital everything. Is this the last phase? I mean, is this going to become more important than ever?
I think so. It's what we call EPHI, Electronic Protected Health Information. And the government is very, very worried about this getting into the wrong hands. More and more offices are going chartless, paperless, more data is going on the computers. It is critical from a government standpoint and just from your own peace of mind that you are protecting that data, you are securing that data as best you possibly can.
And this is affordable.
I think it's very affordable compared to a HIPAA audit, which is going to run you between $10,000 to $25,000, or being audited and found that you're not in compliance, where the fines are going to range from $25,000 to $1.5 million. Yeah, it's very affordable.
But I looked at the prices, though. I mean, with the HIPAA Check, the NetWatch, and the Data Protect bundled together, you're still less than what most companies are charging just to back up data. I mean, is that true?
That's true, and you forgot the fact that we also include antivirus software and unlimited technical support.
And by the way, I didn't forget that. I didn't know that.
It's in
when
there.
were you going to tell me about that? Okay. No,
Unlimited remote technical support is included in our bundle. So whether they need to work with us 10 hours a week or 100 hours a week or hopefully 0 hours a week, it's included. We
but
don't
it's
charge
still
extra.
going to take, okay, so if you're going to do this HIPAA check, you still have to train the office manager on...
It doesn't take long
It's very
at all.
confusing.
The encryption...
Do you offer that type of training?
Yes. Well, there's three components to HIPAA Check. There's the encryption of the data. We do that for them. There is the policies and procedures. We walk them through the first 3 or 4 questions. Anyone with even a high school education can figure it out in a couple of minutes. It's just a matter, there's a series of questions, you answer yes, no, you upload the document, you're done. The final piece of the puzzle for HIPAA Check is encrypted emails. So many dental practices are working with our colleagues. They're sending this electronic protected health information over the internet. It's not secure. That really should be encrypted as well. That takes...
Is it a requirement?
It is a requirement that you take reasonable precautions to protect the confidentiality and security of information. And I think it would be a very difficult argument if you ever get audited to say, we don't think it's reasonable for a very small monthly amount to be encrypting those emails. And the typical practice can learn to use an encrypted email system in about 2 to 3 minutes.
Because everything is digital. Not everything is digital, but everything is going digital, right?
Correct, yeah.
There will be companies that are jumping into this business. How are you going to stay on top of it all? And what will be your competitive edge as you see it?
We think our competitive edge is that we've been doing this for so long. We've worked exclusively with dental practices. We know these systems inside and out. We developed these systems. We built them from the ground up. So we're not just throwing stuff together and hoping that it's going to work. We've got hundreds of...
And you're the tech guy. I mean, you understand this stuff.
Yes, I'm the one.
I mean, this is how you get your kicks. Right?
I have full-time technicians who work for me, but this is my passion. This is what I love doing. So
a dentist, you understand their problems, and then you understand the tech part of it.
That's correct. And our other advantage is that we're not aware of any other company that offers such a wide breadth of services like we do. Everyone's offering certain services. Maybe they do data backup. Maybe they're doing some HIPAA compliance. We're not aware of anyone that puts all of this together into one package.
Now this, on your website, federal reimbursement, what is that all about?
What
does that mean?
What it means is that as offices are going chartless and paperless, the government is encouraging practices to do that. And rather than using the stick as they have in the past to try to get us to do what they want, they're using a carrot. And they're offering certain amounts of funds to offices who can prove that they meet certain criteria, that they've gone paperless, and that they've met those.
Have you ever had anybody that has received reimbursement?
Oh yeah, we definitely have some.
Like how
clients
much?
On this. It's for people through the Medicaid program, they can get up to $63,750 if they've taken all the appropriate steps to be paperless.
And this could be an a la carte as well.
Oh, absolutely.
But is it usually bundled? I mean, when they find out your prices, because you're less, do they usually bundle it?
Most of our clients do. Most of our clients will come to us because they heard about one of the services. We let them know, oh, by the way, it may be more cost effective if you're thinking about some of these other services. And once they see the price, they say, yeah, that makes a lot of sense for us. So the majority of our clients have that.
Okay, look, I don't know about this part of dentistry at all. Okay, so I'm taking your word for it. What could a naysayer, what could one of your buddies say, or somebody say, Randy, I don't know about Lorne, what he's saying about this. The digital dentist, I think he's exaggerating. I mean, could anybody argue with what you're saying?
Well, I'm biased, but I don't think so.
Well, then your friend, I mean, when you meet another dentist, right, you guys speak the same language, what keeps them from switching over?
Inertia. I think people just get so set in their ways. They're working with people. They're just so used to doing business as usual. They don't realize that there's a better way of doing things that's more cost effective, that's going to protect the practice better. And that's really my goal here, is to let people know that there are other things out there.
And you're not much of a sales guy. What I mean is a typical, I mean, you're probably not a pushy guy. I mean, you seem, I mean, know you a little bit now, met you on the phone and met you here today, but don't you want to just sometimes say, hey, you guys have to open your eyes here? You need to make the change.
I try. I can get away with that because these
So you
aren't
do
just,
tell people that.
Yeah, well, these aren't just my clients. These are my colleagues.
But then why don't they do it? I mean, what's the hesitation? Just like what we just talked about?
Yeah, they don't know what's out there.
They must not believe it. They just must not believe it.
They can't believe that there can be so many services that they really need, that we can get them all together, have one person, one company that can handle it all for them at a very cost-effective price. They just don't believe it.
Giving you their data, giving you all of this information, they have to trust you,
Oh,
obviously.
yeah.
Could that be an argument where they say, hey, look, I like the bigger company, $500 million, billion-dollar company, I'm going to put my data with them?
Well,
Does that ever come up?
It does come up.
What do you say to that?
I'm not a $500 million company, but we've been around for close to 15 years. I was a practicing dentist. I understand their needs. I'm not going anywhere. I love this. And even if I got hit by a bus tomorrow, I've got a full team of people who are very much aware of our systems. They've helped me develop it. We would not skip a beat, even if I wasn't in charge.
And I guess some of these companies that don't offer this HIPAA check, right? They're going to be afraid to give you just this a la carte item because then you're going to end up taking away their other things as well.
Once our clients start to see that we offer these other services and it's cost effective and it's effective, that is certainly, I think, a concern that some of the other companies would have of losing their clients to us.
But a lot of people may want to change, but they're on a contract with you. Can you do it? Like some of these a la carte items, could they do it month to month?
Sure.
To try it? Really?
We offer a discount if they sign up for the entire year. We want to obviously to provide the best possible service. We would like to reward them for their trust in us. But if somebody really wants to do things month to month, we have a few of our services that we're more than happy to do without a contract.
Now, as I run a small business, and if a dentist is watching this, I think that they should at least tell their office manager. I'm trying not to side with you, by the way, but I can't figure out why they all wouldn't do it. But they should at least tell their office manager, tell him what we're doing now, and see if he could save us money. Why not? They have nothing to lose, right?
They have nothing to lose. Call us up. We're more than happy to evaluate their systems, be able to let them know where they're at. Even if they don't end up using our services, they have a better awareness of where they are deficient, where the problems exist, and they can find a good solution for them.
And most of the time you're a lot less. Like Geico says 15%, give us 15 minutes. I mean, most of the time you're what, 30% less for everything and all the services you offer?
I'm not aware of any other IT company that offers these services. We don't really have a frame of references, but when you add up all the individual services that we offer, we are absolutely less.
Compares apples and apples, you're less.
If you can compare apples to apples, we are always less than any other time that I've tried to add up all the numbers.
But you say there are no apples and apples, you told me on the phone, because you offer more services.
Right.
Even on the comparative.
When I say apples to apples, I mean when people have all the individual services that they're getting from 3 or 4 different companies and you add up those monthly amounts, that's going to be significantly more than what we can offer with more services at a lower cost.